Welcome to Disability Community and Healthcare. Today, we're diving into a topic that's often overlooked but incredibly important: autism in adults. This is the continuation of our previous video, Understanding Autism, Hidden Disabilities, Causes and Care. We are focusing mainly on the core autism in adults. While autism is frequently associated with children, many adults are discovering their place on the spectrum later in life. So what does autism in adults look like, and how can it be diagnosed? In this comprehensive guide, we will explore the unique challenges and strengths of adults with autism. From understanding the signs and symptoms to navigating healthcare and community resources, we aim to provide valuable insights. Join us as we shed light on this crucial topic and support the journey of adults on the autism spectrum. Autism spectrum disorder, or ASD, is a lifelong condition that can present differently in adults compared to children. Understanding these differences is crucial for providing appropriate support and interventions. While some individuals are diagnosed as children, others might not realize they are on the spectrum until adulthood. This late diagnosis can often come as a relief, providing an explanation for lifelong challenges. This can be due to a variety of factors, including the subtler presentation of symptoms or challenges masking them over time. Many adults have developed coping mechanisms that can obscure the signs of autism. In adults, signs of autism might become more noticeable when life situations change, such as entering the workforce or building new social relationships. These transitions can highlight difficulties in social communication and adaptability. Let's look at some of the core traits that are often present. These traits can vary widely among individuals, but there are common patterns that can help in understanding and identifying autism in adults. One of the key characteristics is a strong preference for routines and predictability. Changes in routine can be particularly challenging and may cause significant stress. Many adults with autism have specific interests that they pursue with great intensity. These focused interests can be a source of joy and fulfillment, but they can also become all-consuming. Social interactions can also be a significant area of difficulty. Adults with autism might struggle with understanding social cues, maintaining conversations, or forming relationships. This can lead to feelings of isolation and anxiety. However, with the right support, many adults with autism can develop meaningful relationships and social skills. Employment is another area where adults with autism may face challenges. The structured environment of a workplace can be both a source of stability and stress. Understanding the unique strengths and needs of adults with autism can help employers create more inclusive workplaces. Accommodations such as clear communication, structured tasks, and sensory-friendly environments can make a significant difference. It's important to recognize that autism is a spectrum, and each individual is unique. What works for one person might not work for another, so personalized approaches are essential. With increased awareness and understanding, we can create a more inclusive society that values the contributions of adults with autism. By recognizing their strengths and providing the right support, we can help them lead fulfilling lives. Thank you for joining us in this overview of autism in adults. Stay tuned for more in-depth discussions on specific aspects of autism and how we can support those on the spectrum. Autism typically manifests across two main areas: social communication and interaction, and restricted or repetitive behaviors. Social communication difficulties include difficulty understanding social cues, facial expressions, or body language, challenges with forming and maintaining relationships, a tendency to avoid eye contact, struggling to initiate or maintain conversations, and a literal understanding of language, like difficulty with sarcasm or jokes. Repetitive behaviors and restricted interests involve engaging in repetitive movements or speech patterns, deep focus on specific interests, sometimes to the exclusion of other activities, and a preference for routine and resistance to change. It's important to note that these signs can vary widely between individuals. Some may exhibit all these traits, while others might only show a few. Understanding these core symptoms and traits is crucial for providing appropriate support and interventions. Support groups and therapy sessions can be beneficial for adults with autism, offering a space to share experiences and strategies. Communication aids and tools can also help in bridging the gap in social communication. Social skills training can be particularly helpful in improving interaction and communication abilities. Encouraging engagement in hobbies and community activities can provide a sense of belonging and purpose. Structured environments and routines can help reduce anxiety and improve daily functioning. Positive reinforcement and celebrating small achievements can boost confidence and motivation. Having a mentor or guide can provide valuable support and direction. Encouraging exploration of new interests and activities can help broaden experiences and skills. In the workplace, understanding and accommodating these traits can lead to a more inclusive and productive environment. Workplace accommodations and assistive technologies can make a significant difference in job performance and satisfaction. Ongoing training and skill development are important for personal and professional growth. Regular feedback and open communication can help in addressing challenges and celebrating progress. Building a supportive community around adults with autism is essential for their well-being and success. Community events and social gatherings can provide opportunities for social interaction and enjoyment. Reflecting on personal growth and achievements can foster a positive self-image and resilience. Setting goals and planning for the future can provide direction and motivation. Celebrating milestones and successes, no matter how small, is important for maintaining motivation and self-esteem. Remember, autism is a spectrum, and each individual is unique. Understanding and supporting their specific needs is key to their success and well-being. If you suspect that you or someone you know may be on the spectrum, it's important to seek a professional evaluation. This step is crucial in understanding the unique needs and challenges faced by individuals with autism. Diagnosing autism in adults is a complex process, often involving questionnaires, interviews, and behavioral assessments. The process is designed to gather comprehensive information about the individual's developmental history, current behaviors, and social interactions. Referral. Adults can self-refer or be referred by a healthcare provider. This initial step often involves a preliminary screening to determine if a full evaluation is warranted. Questionnaires. You'll fill out detailed forms about your developmental history, behaviors, and social interactions. These forms help the healthcare provider understand your experiences and identify patterns that may indicate autism. Behavioral assessment, interaction-based evaluations to observe social communication and repetitive behaviors. These assessments are conducted by trained professionals who look for specific traits and behaviors associated with autism. In many cases, adults may also undergo screening for co-occurring conditions such as ADHD or anxiety, which can sometimes mask or mimic autism traits. This comprehensive approach ensures that all aspects of an individual's mental health are considered. The diagnostic criteria for autism in adults are based on the same principles as those for children, but the presentation of symptoms can be different. Adults may have developed coping mechanisms that mask their symptoms, making the diagnostic process more challenging. During the evaluation, the healthcare provider will ask detailed questions about your childhood and current life. They may also speak with family members or close friends to gather additional insights. Cognitive assessments may be part of the diagnostic process to evaluate intellectual functioning and identify any learning disabilities or other cognitive issues that may be present. Once the evaluation is complete, the healthcare provider will discuss the findings with you. If a diagnosis of autism is made, they will provide recommendations for support and interventions tailored to your needs. Receiving a diagnosis can be a pivotal moment, opening the door to understanding and accessing appropriate support. Many adults find that a diagnosis helps them make sense of their experiences and seek out resources that improve their quality of life. Post-diagnosis, ongoing support and therapy can be beneficial. This may include individual therapy, social skills training, and support groups. The goal is to help individuals with autism navigate their daily lives more effectively and build meaningful connections. Follow-up appointments are essential to monitor progress and adjust interventions as needed. Regular check-ins with healthcare providers Ensure that the support plan remains effective and responsive to any changes in the individual's needs. The diagnosis process is just the beginning of a journey towards better understanding and managing autism. With the right support and resources, adults with autism can lead fulfilling and meaningful lives. Receiving an autism diagnosis as an adult can be life-changing, providing clarity and a sense of understanding. Many individuals feel relief, realizing that the challenges they've faced have an explanation. However, it can also come with its own set of questions. What support is available? How can you navigate life with this new information? One of the first steps is to seek out support groups and communities. These groups can provide a sense of belonging and shared experiences. Engaging in activities that you enjoy and finding like-minded individuals can be incredibly beneficial. Setting realistic goals and working with a mentor or coach can help in managing daily life and achieving personal aspirations. Mindfulness and relaxation techniques can also be useful in managing stress and anxiety. Educating yourself about autism and staying informed about the latest research can empower you to make informed decisions. Building a support network of family and friends who understand and respect your needs is crucial. In the workplace, it's important to communicate your needs and seek accommodations that can help you perform your best. Utilizing assistive technology and creating an organized environment can enhance productivity and reduce overwhelm. Regular self-reflection and therapy can aid in understanding your experiences and emotions. Celebrating your achievements, no matter how small, is important in maintaining a positive outlook. Giving back to the community and helping others can also provide a sense of purpose and fulfillment. Living with autism as an adult comes with its challenges, but with the right support and strategies, it is possible to lead a fulfilling and meaningful life. Autism in adults is more common than many think, and understanding the signs and seeking a diagnosis can open doors to support and a better quality of life. If you found this video helpful, make sure to like, share, and subscribe for more content around healthcare and community support. For more information on autism in adults, check out the resources linked in the description below. Remember, seeking help and understanding autism can significantly improve one's quality of life. For more information, please check out links to Autism SA, Autism Awareness, Autism Speaks, and other relevant resources.